Okay, so I'm going to walk into my patient's room and I'm going to first perform hand hygiene. Now I'm going to introduce myself to the patient. Hi, Mr. Johnson. My name is Jan and I'm going to be your nurse today. I will be conducting a blood draw from you. Are you in any pain right now? No. Okay, perfect. Do you have any allergies that we should know about? Okay, great. Alright, so first I'm going to perform hand hygiene again before I begin the procedure and then place the gloves on. Alright, so first I want to make sure that I have all these supplies that I need. First off, I need the tourniquet, what is it called? The vacuum, and then the blood collection tube, along with the needle and gauze. Alright, so, and then an alcohol swab, or wipe. So the first thing I'm going to do is use the tourniquet to take a look at the veins and decide which vein I want to use. I'm going to apply this as tightly as possible. Alright, so I'm just going to feel around and pick which vein I believe would be best. Alright, so I found my vein. I'm going to use this vein. I'm going to undo this while I get my things ready. And for the purpose of time and to make sure that things go smoothly, I'm going to attach the vacuum first before. That way I do not struggle with it afterwards. Alright, so I found the vein I would like to use, so I'm going to wipe it off. Alright, and for the purpose of this video, we're just going to assume that this has dried off completely. We are ready to draw the blood now, so we are going to reapply the tourniquet tightly. Alright, and so now I am going to get my needle, feel for the vein again, and go in. Alright, perfect. So I am just going to apply some pressure right there. I'm going to let go of the tourniquet, grab my blood collection, and put it in. Alright, so for the purpose of this video, again, we are going to assume that this filled up with blood. So we are going to unattach it, put that off to the side, and then now we are going to pull this off and apply pressure to where the needle has been placed. Close this off, and then apply pressure towards on the wound. Okay. Alright, so now that that is good to go, I will put that into my glove. Take my gloves off. I'm going to perform hand hygiene again. Alright, Mr. Johnson, we are all done with your Okay, so now that we've collected the patient's blood, we are going to go ahead and start an IV on him. Again, I am going to perform hand hygiene and put some gloves on. Alright, so my gloves are on. Before I begin the procedure, I'm going to make sure that I have all the supplies that I need, starting with the needle and the catheter in there, gauze, the saline, and then the tubing along with alcohol pads. So the first thing I'm going to do is again use the tourniquet to assess for which vein I would like to use, putting that as tightly as possible. Alright, and then I'm going to palpate around to find the vein that I would like to use. Alright, so I'm going to use this one. I'm going to undo this And then I'm going to clean off the area. Alright, and then while I'm letting that dry, I'm going to go ahead and connect the tubing to the saline just to make it a little easier, because our time is very limited once we, yes. Alright, so then now once that is on, I'm going to prime it to make sure that it is going through correctly. Perfect. Alright, so the area is dried off now. I'm going to redo the tourniquet as tightly as possible. Feel around again. Open up my supplies. Alright. So I'm going to feel around again just to make sure. I'm going to apply pressure right here. Pop it right there. That comes off, and then I'm going to attach the tubing to the catheter. Alright, perfect. So now I'm going to retract a little bit to make sure that we got a vein right there. Alright, perfect. We have some blood right there, so then I'm going to flush it again. Alright. Alright, so I'm going to cut a piece of tape off, and then now I'm going to put the piece of tape on top of the catheter to make sure that it stays in place. Alright, perfect. And then now I'm going to unhook this from the saline and use another piece of tape that I had off to the side to hold on to this. Now that all of this has been taped down to prevent it from running off, we are going to connect the line to this IV. The IV bag has already been spiked, primed, and prepped, and so now all I'm going to do is just connect the line to the IV. Alright, perfect. So then I'm just going to make sure that it is all unhooked. Alright. Perfect. It is running through perfectly, and we gotta assess for any air bubbles, and I do not see any. Okay. Are you experiencing any pain right now? No? Okay, perfect. Alright, so that is a very good sign for us. Alright, so now that that is all hooked up, I am going to take my gloves off, perform hand hygiene again, and then I will document the procedure. Okay, documenting it. Alright, sir, so we are all done with your procedure. If you experience any uncomfort, please let us know, and we will come assess the IV. Thank you.